Welcome to another Health Announcement Spotlight. I'm Health's Head of Content, Jody Tropiano, and joining me today, I have Dr. Amy Meister, WeightWatchers Chief Medical Officer, who will be sharing a bit more about their recent move into the clinical space. Welcome, Dr. Meister. Can you start us off by sharing a bit more about your background and your recent journey into joining WeightWatchers?
Thank you very much. Glad to be here. As an internal medicine physician, I've had the opportunity to treat much more than just obesity, but the accompanying chronic conditions for years. I've also had the opportunity to examine claims data and spend a lot of time with payers and employers to help them make decisions about their benefit designs and solutions to help them improve the health of their employees. I quickly noted that the root causes of a lot of these higher costs for employers could be drilled down to those that were covered under benefit design and living in an unhealthy weight. I'm so excited to be part of this program and to continue to grow and integrate our new clinical interventions to have that full spectrum of coverage.
Amazing. And let's talk a little bit more about that integration. Can you bring us along the journey of how WeightWatchers moved into the clinical space, specifically choosing to acquire Sequence?
Absolutely. WeightWatchers did not take it lightly. They knew that they needed to be able to create improved access. Right now, if you try to get a health appointment, many times it's challenging. Even if you have an established relationship with your provider, they wanted to have ease of access. And they wanted, through their new and enhanced digital platform, to have that digital front door that once you're inside and we're assisting you with your journey and weight health, that you could choose your own adventure, whether that's using our traditional program or even moving fast forward to needing a provider and prescriber. And what did we look for? We really looked for member and physician experience. It's all about that experience that make you want to stay with us and to help drive outcomes. Second, we looked for obesity expertise and training. And lastly, one of the most important things of all the exhaustive criteria was quality standards. We wanted the highest quality group and something that would be a continual learning experience to make sure that if the science changed, that the company would reflect that changes and bring that to market as well.
Excellent. And can you share maybe a bit more about some proof points?
Oh, absolutely. So a couple of things that are really interesting. When we think about proof points, if you just think of our offering in really three essential buckets. Bucket number one would be our behavioral only program. That's legendary, that everybody is really familiar with. One of the things that attracted me to WeightWatchers was the fact that they had over 150 publications in peer-reviewed journals, additionally had over 38 randomized controlled trials that are so important to anchor to the science. That made me not only excited about the outcomes, but knowing that they have a science division that works really hard to think about innovation and what's next. With the WeightWatchers traditional behavior program, patients or participants usually experience about 4 to 5% of body loss in the first 4 months and up to 7% by 12 months. In the second bucket, we have folks that now are on medications, particularly the GLP-1s that you've heard about in the marketplace, but they need something different than our traditional program. Our traditional program of points is fantastic, but when you're going through the journey of utilizing a GLP-1, sometimes you have trouble getting those macronutrients that you need. Things like enough protein and fats in your diet to make for healthy weight loss. So we created a custom program to wrap around that pharmaceutical component if it's being prescribed by a PCP or endocrinologist or another medical group, that we're able to plug in and help support to make sure they're getting the right nutrients, getting the right hydration, and also, just important, making sure they get the resistance training they need to not lose healthy muscle tissue. And then you add the ability to also prescribe. What do those results look like? Well, what we're seeing is that it's not 1 + 1 = 2, it's 1 + 1 = 3. We're actually seeing an incremental results of over 16% improvement. So substantially improving what was already good products individually, but when they came together, are really having a best in class. And the last thing I'll say about proof points that I think is so impressive, and stay tuned, coming in a publication soon, is that after a period of time, some people that are on pharmacotherapy have chosen to either go off the medication or for a medical reason needed to discontinue it. What we're seeing is those that have our foundational behavioral program actually continue to lose weight for an additional 2 to 3% for over the next 3 months after stopping the medicine. Because there are a lot of questions about what happens if I go off the medication, will I rebound right away? Well, preliminary results again, but we're really optimistic with our behavioral program as supporting that pharmacotherapy and weight loss, that after discontinuation, we're still seeing not just sustained results, but actually additional weight loss.
Yeah, it's incredible results. Well, we've heard you say weight health. Can you explain a little bit more what you mean by that term?
I remember back earlier on in my career when we first started talking about mental health. It was not mental health at all. We talked about mental illness. We talked about psychiatric disease. In fact, for many people, this was carved out of their insurance plans and coverage. It was so hard to get people care. And although we haven't solved for all those problems, we've definitely improved the situation by changing the paradigm from illness to mental health. We want to do the same thing for weight, to change it from thinking about a number, which is simply a snapshot or a picture in time, to thinking about a moving picture that tells a whole story. It's a comprehensive view of your needs that are going to change as your life changes.
Well, I appreciate you all leading the charge. It's a really important cultural shift in the way that we talk about weight. So with that, any last thoughts for our audience? Anything you want to share with them before we close?
Thank you. We've taken our renowned behavioral program, which consists of our legacy best-in-class coaching. It's like having support staff on speed dial, and added our community. Your community is so important, whether it's in person in real life or virtually, and combined it with the best-in-class virtual obesity clinical program. So what this does, it addresses both the behavioral component and the biological factors that often prevent weight loss. It's truly disruptive and really will help us help others live their best life possible.
Amazing. Well, thanks again, Dr. Meister. Appreciate all that you're doing.
Thank you.